Is it safe to mix the vaccines? The question that Canadians continue to ask as vaccinations continue to roll out. Eagle News correspondent Cherry Recolizado has the story.
Earlier this week, a statement from the World Health Organization confused many Canadians as to whether or not it is safe to mix vaccines. Here's the statement.
There is limited data on mix and match. There are studies going on. We need to wait for that, and maybe it will be a very good approach. But at the moment, we only have data on the AZ vaccine, Oxford AstraZeneca, followed by Pfizer.
Canada has been following NACI's recommendations to mix mRNA vaccines when the same mRNA vaccine product is not readily available. This statement from the WHO was published in several Canadian media websites, with some quoting the WHO saying that this was a dangerous trend, leading to some panic responses from those who have already taken a different vaccine for their second dose, and increased hesitancy from those who have yet to take their second dose. This has prompted an immediate response from some known Toronto doctors, one of them, infectious diseases physician and scientist, Dr. Isaac Bogosh. We see data from the UK, Spain, and Germany demonstrating that mixing vaccines in the manner we're doing in Canada is safe and provides a significant or robust immune response. To help clarify things, Dr. Samya Swaminathan, WHO's chief scientist who made the statement, posted that individuals should not decide for themselves. Public health agencies can, based on available data. Data from mix and match studies of different vaccines are awaited. Immunogenicity and safety both need to be evaluated. Here are some responses collected in regards to this issue.
In terms of the WHO statement, I do agree with the scientists to some extent. It's true that there is limited scientific research behind mixing vaccines. However, a lot of people are taking it out of context and not really understanding what they actually meant. In terms of Canadian doctors, I think right now they're looking at the short-term effects. Right now, people have been mixing and there's no bad effects. However, I know they're doing long-term research to see that.
We just have to be aware or beware of health misinformation that are often being posted on social media. It is recommended for us to speak with health professionals for facts and for them to listen to our concern.
Dr. Eileen Davila, Toronto's Medical Officer of Health, further clarified in a press conference that Dr. Swaminathan's statement was simply taken out of context.
There has been some confusion following comments on Monday by an official of the World Health Organization. She was responding to a question about the need for future booster shots. Since then, her answer is sometimes being repeated as if she was talking about the mixing and matching of first and second doses. She was not. She was describing what would happen if people decided to try to get a booster on their own and did not rely on medical advice.
In addition, Dr. Davila reassures the public of the safety of mixing vaccines.
I myself received Pfizer for my first dose and Moderna for my second, and I can assure you that I am very comfortable that I am protected. The best vaccine is the vaccine you can get, and we're fortunate that there are lots of options now on where to get your vaccine.
As the city continues to see a decrease in new COVID-19 cases and works hard to increase its vaccination rates, the message remains the same: to get fully vaccinated as soon as possible. In Toronto, Cherry Recolizado, Eagle News. We live in interesting times.